Thank you, Mr. Speaker. Mr. Speaker, I want to take this opportunity to first start by thanking the Leader of Majority for coming up with this motion. Mr. Speaker, Kenya, like any other nation in the world, is facing tough times. And we all know that managing and controlling this pandemic is not easy. We are working hard, Mr. Speaker, but this is a pandemic. This is not an epidemic. So, Mr. Speaker, we are confronted by a number of challenges that we must deal with. There is the health crisis that we are all aware of. We also have issues of social intervention, humanitarian issues. But above all, Mr. Speaker, even if we manage to control this disease, the economic effect, the economic challenges is going to live with us for quite a bit of time. Therefore, Mr. Speaker, it is a time that as a country we must speak with ourselves. We must look inwards and look for solutions to our problems based on our environment and our circumstances. Mr. Speaker, I want to start by talking about the health issues because that is the most critical, the most immediate. Whereas I would start by appreciating the work of the executive, the work of the ministry, the work of the president in trying to manage this pandemic. But, Mr. Speaker, we must also tell the government in no uncertain terms that their reaction and response has been wanting in a number of ways. Number one, Mr. Speaker, the government has been talking to us because we are looking for exit strategy. We have to get out of this pandemic in one way or the other. And for us to get an exit strategy, the executive, the government, the ministry must lead the initiative. We are seeing and we support and we appreciate the daily reports about the numbers. But, Mr. Speaker, we need explanations. We were told that this country has capacity to test about 30,000 people, 37,000 people in a day. Mr. Speaker, as we speak, the highest number that has been tested is just slightly over 1,000 in a day. What is the reason? What is the justification? What is the explanation? This is not forthcoming. And we want to tell the ministry that they must step forward. They must escalate. What they have been saying is good, but it is not good enough. Now they must speak with us and tell us for how long are we just going to be seeing the numbers of 22, 25, 45? What is the game plan? Every country in the world has a game plan. So, Mr. Speaker, the government must be serious about mass testing. If there are no resources, provide it. And, Mr. Speaker, it is disheartening that the budget estimates have been tabled here. And if you look at those budget estimates, it is business as usual. There are no clear provisions for resources to fight this pandemic. Why is the government of Kenya taking Kenyans for a ride? For how long are we going to wait for this government to behave normally? And they are the ones who are telling us not to behave normally because the disease is going to treat us abnormally. It is the government that is behaving normally, and the disease is behaving abnormally. So, Mr. Speaker, we are waiting for clear government intervention in terms of resource allocations. I would tell you, if you look at the budget estimates that were tabled here last week, Mr. Speaker, the amount that is directly linked to COVID-19 is 2.6 billion in a budget of trillions. Mr. Speaker, something is happening in this country that needs to be addressed. And we are the people's representatives. We must address it. Mr. Speaker, the other bit is about social intervention. Mr. Speaker, the biggest problem that our people are facing is food. They are hungry. Forget about even COVID-19. In fact, our people tell you, Mr. Speaker, I'm sure you go to your constituency. They will tell you how many people have died of COVID. And I'm not saying we should be relaxed. But they will tell you they are suffering and they are likely to die from hunger. If you look at our budget estimates, this is not a time to invest on capital expenditure, to build roads, to do what? We can live without roads as we eat. Right now, what Kenyans are concerned about is they want to eat. So, Mr. Speaker, we must provide funds for our people to eat. Every constituency, the poor people, those who are living below poverty line, must get government funding to be able to eat. And by the way, these figures are there. Mr. Speaker, like if you come to my constituency, they are numbering about 6,000 households. I'm sure if you extrapolate that to the whole country, it comes to about 1.8 million to 2 million households. Household is averaging 5 to 6 people. If you have to feed these individuals, Mr. Speaker, for like 4 months, 5 months, you need not more than 20 billion. This is something this country can afford. So, Mr. Speaker, as a House, this is the time for us to rise to the occasion, look at the budgets that have been tabled here, and deal with it radically to make sure that food is provided to our people. Mr. Speaker, the Leader of Majority has talked about police brutality. Other members have talked about police brutality. I want to repeat it, that whereas we support the enforcement of various regulations and rules so that our people don't get infected, it is not a license to anybody in this country to reintroduce police torture, to reintroduce cases of mishandling Kenyans. Our constitution is robust about human rights. Human rights must be respected. Where they violate those rights, there is the due process of the law. Take due process of the law, but don't kill our people. They don't deserve to die. The Constitution is clear. No one is allowed to take out the life of any individual. Please, whoever is taking advantage of this crisis to bring dictatorship to the country, stop it. Even the cases we are seeing of eviction in some areas, I'm not talking about those people who have been stealing land, like in Ruai. Those ones you can deal with, because you don't even see them there. But, Mr. Speaker...
I'm sure you're almost concluding.
No, I have 10 minutes, Mr. Speaker.
Yes, you don't have 10 minutes. No, you actually don't have 10 minutes, if you remember. If you remember the resolutions of the House that we did on some times back, the debate between April 22nd and April 29th, May 6th, you have 5 minutes. But anyway, you have a minute to conclude, minority.
Mr. Speaker, I thought that is something we discussed. I think it was a mistake, and the clerk there on the table knows that the leader, we agreed that I have 10 minutes, and please don't take away my 10 minutes. Mr. Speaker, I'm speaking as the leader of minority.
Yes, that is where you...
And that voice must be heard.
Minority leader.
And the chairman of one of the most serious party in the country. Mr. Speaker, let me just touch on the 3 last issues. On economic issues, the livelihood of our people I've talked about. I am talking about businesses. Mr. Speaker, we must create economic stimulus to help the small and medium enterprises. Mr. Speaker, I have talked about food, but let me put it this way. Kenya is a net importer of food, and every country is struggling to survive. What strategy does this government have in the event that the countries which give us food decide now to use their foods locally? This is the time to respond. Finally, Mr. Speaker, because I don't want to disagree with you much, you are my friend.
No,
I want to talk about...
Minority leader, you actually have 10 minutes.
Yes, I have 10 minutes.
I have confirmed that from the motion.
Thank you. Yeah. But let me conclude, because now I think I've said the bit that I wanted to say. I want to just touch on the 2 last issues. One is the financial sector, which is likely to face distress. The government must come up with a strategy of ensuring that this country does not get have the financial sector come down in terms of financial distress. And the government financial distress, Mr. Speaker, interestingly, even after talking about what I said about the estimates, even though the government is not providing funds to respond to COVID-19, but you still find our public debt going up. The most unfortunate is that the government is even proposing to increase domestic borrowing from slightly over 200 billion to over 400 billion. And yet they are claiming to be reducing the CBR rate downwards. How on earth would you think of increasing domestic borrowing at this time? Mr. Speaker, my concluding remarks are, please, the government get serious, even though we are in a crisis, but get serious. Mr. Speaker, allow me this. There are areas in this country where people are dying of floods. Over 100 people have died. COVID has only killed 14. All the attention is on COVID. People of Budalangi are left on their own. People of Nyando are on their own. People of Karachuonyo are on their own. People of Kochia are on their own. People of Migori, Nyatike, Konyango, Luanda, they are on their own. No one thinks about them. Mr. Speaker, which is this country that we are living in? The government gets serious. If you have been sleeping, please wake up. And if you have been sleeping because of the handshake, Mr. Speaker, the handshake did not mean that now you do things the way you want. They must know that minorities still exist. Thank you, Mr. Speaker.
Thank you, Mr. Speaker. Mr. Speaker, I want to take the opportunity to thank the government for sensitizing people at the start of this pandemic, Mr. Speaker, for the press conferences that they have been holding and alerting people. In the absence of that, I think the issue will have gotten out of hand. But, Mr. Speaker, as a House, we have constitutional responsibility also to oversight the government. And the government has failed in many ways, Mr. Speaker, that Kenyans didn't expect, Mr. Speaker. Mr. Speaker, the fight of this pandemic of coronavirus must have a human face, Mr. Speaker. It can't be the government has not suspended the Constitution, neither has Parliament done, Mr. Speaker. I cannot overemphasize, Mr. Speaker, of the issue of police brutality, as has been said by the leaders here, Mr. Speaker. There is no country in the world, Mr. Speaker, that has reported cases of death through police brutality more than Kenya, Mr. Speaker, in the whole world, because this pandemic was an equalizer. It was happening all over the world, all over the globe, Mr. Speaker. Mr. Speaker, our police force cannot behave like goons in uniform, Mr. Speaker. These are people who have been trained properly to protect lives and property of Kenyans, Mr. Speaker. That's why they are, Mr. Speaker. Unless they have instructions to do that, Mr. Speaker. Secondly, Mr. Speaker, this government has not done anything that is tangible other than announcing numbers, Mr. Speaker, every 3 o'clock of the day, Mr. Speaker. Mr. Speaker, this is one government that could not afford to give its citizens this thing, what is called, a mask, Mr. Speaker, which is worth 3 shillings, Mr. Speaker. Leave alone food. No, let's say 20 shillings. Members of Parliament are buying in their constituencies for people masks, Mr. Speaker. We were told that there will be free sanitizers, Mr. Speaker. Kenya Pipeline will produce alcohol-based sanitizer, Mr. Speaker. Corona is almost ending. I think they have washed it with their hands. Now they are washing it with their legs, Mr. Speaker. Because we have not seen any free sanitizer in our constituency, Mr. Speaker. Mr. Speaker, it cannot be business as usual, and we keep quiet. We have the mandate constitutionally to represent the people. We have sovereign power, Mr. Speaker. Mr. Speaker, this is a government that is unable to feed its people, that cannot give free masks to its people, that cannot give free sanitizer to its people. What else can they do? Mr. Speaker, we are not going to allow this government to contact trace people who have coronavirus in their homes, force them into quarantine, and expect them to pay for the upkeep, Mr. Speaker. The government must pay for the upkeep of people in quarantine that they have traced through their contact, Mr. Speaker. Mr. Speaker, if somebody has broken the law, you can quarantine him. No, I have not finished. I know you're not happy with what I'm saying today. Mr. Speaker, if somebody has been traced with quarantine, Mr. Speaker, and is quarantined, the government must pay that bill, Mr. Speaker. They have the money. Mr. Speaker, this money that is for the war on coronavirus, Mr. Speaker, the government must account for it shilling by shilling, Mr. Speaker, penny by penny. This country is known for people who enrich themselves through miseries, disasters. They are known. They are in offices, Mr. Speaker. This coronavirus money, whether it is the COVID fund, whether it is government fund, we want them to account to this House, Mr. Speaker, coin by coin. Look, people are discussing shamelessly 3 or 4 million shillings and mandasi, Mr. Speaker, when our people are dying of corona. People are dying of shame, Mr. Speaker. Shame, Mr. Speaker. We must condemn that act with the strongest terms possible, Mr. Speaker. That people can sit in offices and use 4 million shillings to eat tea and mandasi when people are dying of hunger, people are dying for not having mask, people are dying for not having sanitizer, people are dying out of flood, Mr. Speaker. It's very shameful, Mr. Speaker. And you call yourself government. If it was in democracies that have matured, this government will have resigned. Mr. Speaker, we will have had a general election now, Mr. Speaker. Because you have, if you cannot defend your people from floods, you cannot defend your people by buying them masks, Mr. Speaker, you're not worth even the name to be called government, Mr. Speaker. Mr. Speaker, in conclusion, I want this House to rise up to the occasion and hold this government accountable for every action, omission, and commission that they do against the people of this country, Mr. Speaker. With those few remarks, Mr. Speaker, I really condemn what's happening in this country.